Okay, so connective tissue, which is we already discussed, in which in a special kind of tissue, sclerous tissue. In the last class, we discussed about the cartilage in the sclerous tissue, and today in this class, we are going to discuss histology of bone and in detail. So, what is the function of the bone? So, it support and protect the organs, as we know that the ribs are supporting and protecting the heart, lungs. Then it provides levers and attachment site for the muscles in the limbs. We can see it and store calcium and other minerals. It store fat also, and bone marrow in which is the site for the blood cell formation. After that location, bones bones are specialized hard connective tissue that made up of in the following manner. Actually, location we all already know that where the bones are found in all over the body. In the cranial bones are there. In the neck, cervical vertebrae are there. Then in the thoracic region, thoracic vertebrae as well as ribs are there. And in the limbs, we know that in the forelimb, in the hind limbs. Okay, so after that, if we are going to discuss in the detail about the structure, we should know that what are the different structure. First is the periosteum. So periosteum is covering outer surface of the bone except the articular surface, and periosteum is not present in sesamoid bones. Sesamoid bones means like patella or some small bones which is found in the distal end of the limb in the caudal aspect, like navicular bones are there in between the digits in the posterior aspect in the limbs of cattle and horse and dog. We have seen it. Now what is articular cartilage? We already discussed that articular cartilage covers the articular end of the bone to provide friction free smooth surface, and it is made up of hyaline cartilage. Then bone cells. So bone cells are the osteoblast, osteoclast, and osteocyte. So what is the osteoblast first? Osteoblast are round or oval cells with a process and large nucleus. Then after that, next is the osteoclast. Large nucleus is there and the process are there. Remember this point. And in the osteoclast, they are large multinucleated cells. In the osteoclast, nucleus are multi nuclei, means there are more than one nuclei are there. So in the osteoclast, they are multinucleated cells with pale foamy cytoplasm which are derived from the mesenchymal cells. Okay, so these are derived from the mesenchymal, which is embryonic connective tissue cells. And like osteoblast are formed by the fusion of the few osteoblasts. So means they are either formed or derived from the osteoblast, similar to that that is derived from the mesenchymal cells, and by the fusion of the osteoblast also they are derived, and they are active during bone reabsorption. Means what? They are active during bone reabsorption. Means reabsorption means there is a formation of new bone, and then it means that reabsorbs bone salt and are active during growth and remodeling. Okay, so that is the at that time these osteoclast cells are active during remodeling of the bone and growth of the bone. There are these cells are playing important role. Then osteocytes, they are mature bone cells and are derived from the osteoblast. When osteoblasts get mature, they are known as osteocytes, and each of these are housed within a tiny space called lacuna. Okay, similar to the chondrocytes we have seen. Now in this photograph we can see the osteogenic cells develops into an osteoblast. This is the osteoblast, this is osteogenic cells, this is premature cell, this is osteoblast. Forms bone tissue. The osteoblast will form the bone tissue, and these are the osteocyte. It is a main bone tissue cells that maintains the bone tissue cells. And we can say that after that, this is the osteoclast, that is the helps in the reabsorption and destruction of the bone matrix. And we can say that the ruffled border, the multinucleated structure here. So what I told you, the osteoclast are the multinucleated. So we can see here the osteoclast which is multinucleated, which is visible like this. Okay, these are the osteoclast. Now Come to the next point, intercellular space. Intercellular substance comprises of organic material and inorganic bone salt. Okay, in the bone, that is hard structure, we know that. So in the form of hard structure, we are having here intercellular space substance, that is actually the organic and inorganic bone salt. Then bone marrow. This is soft, pulpy, vascular tissue. Okay, blood vessels are there, and it is soft, pulpy in nature. Inside the bone, it is there, and it is this tissue accommodated in the medullary cavity of the long bone and in the marrow spaces of the spongy bone. In the marrow spaces of the spongy bone, and there are two types of bone marrow: red bone marrow and yellow bone marrow. In infants, bone marrow is generally red. In infants means newborn, the bone marrow is generally red. With the advancement of the age, the red bone marrow gradually replaces by the yellow. Means in the newborn it is red, but it is yellow in the uh, with advancement of age. Now, based on the microscopic structure, so what we have seen the intercellular space of the bone, what are the bone cells, what are the periosteum, articular surface, and we have seen that the bone marrow. Okay, now come to the other things about the bone, that is the what, that is the we are going to discuss about the classification on the basis of microscopic structure. So first is the immature bone, that is also called woven bone, and it is a non-lamellar bone. Then after that, second is the mature bone, that is also called lamellar bone or Haversian bone. Okay, and it is of two type, that is a compact bone and cancellous bone or spongy bone, that is also called trabecular bone. Okay, so here you should remember that immature woven and non-lamellar is the different thing, but the compact, cancellous or spongy is another thing, that is also called trabecular bone, and as a whole that is called mature means Haversian or lamellar bone. Now, first is the immature bone or non-laminar bone. The immature or woven bone, that is referred as woven bone, helps in the fracture repair, highly disorganized and highly cellular. And the woven bone, histological name for immature bone, it can be compact or cancellous. Okay, so woven, it either it may be compact or cancellous, but the woven name is given as immature, it means it is immature. Next is the Haversian bone, that is histological term for adult bone and can be compact and cancellous. So adult bone भी complex और compact भी हो सकती है, and that is also the spongy. It is depending upon the location, because spongy is found on the ends of the bone but compact in the shaft of the bone. And it in the shaft it may be immature during the we can say that remodeling time. It is of woven type or it may be of Haversian type. So in this photograph we can see, this is the photograph is showing you the immature one, which is showing that the health and this health, that is at the time of fracture repair, it is immature bone is there. It may be on the compact as well as on the spongy substance or the spongy bone location on the end of the bone, we can say. And it is highly disorganized, we can see here. It is highly cellular, numerous cells are there. Okay, so these are the cells we can find in these location. Okay, these are the substance, marrow substance. Now, histology of the woven bone and lamellar bone, that are two types of the bone can be identified microscopically according to the pattern of the collagen forming the osteoid or collagenous support tissue of type 1 collagen embedded in the glycosome in the glycans. Woven bone, which is characterized by the haphazard organization of collagen fiber and is mechanically weak. Okay, and lamellar bone, which has a regular parallel alignment of collagen, okay, into sheets or lamellae, and it is mechanically strong. So that is the lamellar means mature bone, but non-lamellar means haphazard organization of collagen fiber and it is mechanically weak. Then woven bone is produced by osteoblast, produce osteoid rapidly, which occur initially in all fetal bone, but in later it is replaced by more resilient lamellar bone. In adult, woven bone is created after fracture or in Paget's disease, and woven bone is weaker with a smaller number of randomly oriented collagen fibers, but forms quickly. It is for this appearance of the fibrous matrix that the bone is termed as woven. It is soon replaced by lamellar bone, which is highly organized in concentric sheets with a much lower proportion of osteocytes to surrounding tissue. After a fracture, woven bone forms initially and is gradually replaced by lamellar bone during the process known as bony substitution. Okay, so after a fracture, the woven bone forms the initially and which is gradually replaced by lamellar bone during the process known as bony substitution. Means substitution means immature bone is substituted by the mature bone, and compared to woven bone, the lamellar bone formation takes place more slowly. Next point we can see here lamellar bone which is having organized, this is the woven or immature or non-lamellar which is having disorganized orientation of collagen fiber along with the osteocytes. Here we can see the lamellar means organized manner. We can see the osteons. This is the osteons. We will see it in later. Here this is the disorganized manner. Now the mature bone. This is a composed of numerous system of so where we have seen this is the concentrically we can see that numerous like this concentric arrangement of what it is the osteon we will see. So this is composed of numerous system of concentrically organized bony lamellae around a central canal, the Haversian canal, which run longitudinally and enclosed blood vessels. Each concentric system is known as Haversian system or osteon. Then Haversian canal of adjacent system are inner or interconnected by transverse channels, that is called Volksmann canal. Connect Haversian canals with periosteum or endosteal surface. So Volksmann are horizontal. We will see, suppose this is a bone in the section, and along the if we see like this in the like this they are inside the bone they are like this. So along the line of length Haversian canals are found, and on the parallel way this Volksmann canals are found to connect these lamellae. Okay, in cross section of the bone, the Haversian canal are seen to be surrounded by varying number, means 8 to 15 concentric lamellae, and these concentric lamellae and the central canal constitute a Haversian system or osteon. So numerous osteons are there, and in the periphery, the lamellae are not concentric but run parallel with the surface. So in the periphery, the lamellae are not concentric but parallel with the surface. Means they are like this. Numerous are there, but in the periphery, not there. Around there like this in the around the periphery of the bone, and are concentric. And we can say that it forms a relatively thin outer layer at the base and outer surface. Now we can see the finally the interval between the Haversian lamellae are occupied by the more irregular layer of bone which constitute the interstitial lamellae. We will see in the photograph, and adjacent lamellar system are as a rule sharply delimited from each other by dark staining and thin layer of modified matrix, that is cement membrane or cement line. And lacunae are the spaces between these lamellae where osteocytes are housed. From these lacunar spaces, very fine canals extend all around in a radiating manner, which accommodate fine cytoplasmic process of the osteocyte, and these are known as canaliculi. We will see here now. So this is the Volksmann canal which is connecting the, we can see that lamellae, and this is the outer circumferential lamellae. We are that is peripherally parallel, and inside that we can see the osteon, this combined structure that which is including the concentric lamellae, and concentric lamellae are having the lacunae in which the osteocytes are found. As we can see, the all around the lines concentric lamellae, these all lacunae are there. And this is the inner circumferential lamellae, this is outer circumferential lamellae, this is the endosteum, this is the periosteum, this is the Volksmann canal. In these location Haversian canals are found. We can see here, this is the osteon, this is the Haversian canal here in the mid position, and the interstitial lamellae we can see like this. So this is the remodeling, means like this structures are forming, and this is the ongoing process, like this they are forming and disorganizing. In the meantime new are forming and the old one are become the interstitial lamellae. Like this we can see this, these are the osteocytes or lacunae, and this is the Haversian canal. There we can see these are the canaliculi, the process, cytoplasmic process, which is all around the lacunae or osteocytes, which is found or visible here, that is the canaliculi. So lacunae are the space in which the osteocytes are found, and canaliculi are the, these are the process we can see in the photograph. Now coming to the next photograph, that the young developing bone having osteoblast on the surface producing new bone, and on inner surface we can see endosteum. So we can see that inner surface is having endosteum, and on deeper end we can see osteons. So we can see, this is the osteoblast, these are the osteocyte, this is the periosteum. Okay, and there we can visualize circumferential lamellae. Okay, and that is Haversian canal. So these are the circumferential lamellae where we can find the Haversian canal. Now this is the medullary cavity on the inner side. These are the osteoclast. These are the bone. This is the periosteum. This is the cross section through the myofibrils. This is another photograph showing you the lacunae. These are the osteocytes inside the lacunae. Here we can see the central canal or Haversian canal. Here we can see these are the lamellas. These are the canaliculi. Similarly, in this another photograph, the same thing as a whole, this structure is called osteon, in which the lacunae and Haversian canals are also visible in this section. This is the another photograph showing you the osteon or Haversian system as a whole, we can say. These are the Volksmann canal in the section appear like this. These are the lamellae, or these are the lacunas. Lacuna is the space in which the osteocytes are found, and lamellae is the circular structure, that is the circumferential lamellae, inner circumferential, outer circumferential lamellae. In this another photograph, these are the Volksmann canal, this is the Haversian canal, this is the lacunas. Now the next photograph is the showing you the configuration of the bone. So cancellous spongy bone or trabecular bone is the that is found, the substance of, we can see what is written here. This is the cancellous or at the end of the bone that is found. The substance of the all the bone other than the soft of long bone are composed of a spongy bone, and it looks like a hard sponge and contains numerous small spaces between the bony trabeculae and spicules, and therefore also called cancellous bone, and the spicules of the spongy bone called as the lamellar or trabecular structure. That is why they are called trabecular or spongy bone or cancellous bone. So we can see another photograph which is showing you the calcified cartilage, osteon in the lacuna, and lamellar bone tissue like this, as adipocytes are there in the inner side. Now this is the another photograph which is showing you the configuration of bone. This is the cancellous bone. So that is why they are, cause of it appear like a spongy in appearance. So that is why it is called a sponge, or a spongy bone. Now the next, compact bone. So this is the structure which is red marked here. This is the outer surface structure, or this is the compact bone, and the compact bone is visible here also. This is the spongy bone in this location where I have written S, and this is the compact bone, that is the outer wall like structure. So configuration of bone we have seen. Now osteogenesis. So intramembranous type. First is the intramembranous type, like cartilage, fetal mesenchyme differentiate into periosteum, and then osteoblast. Okay, and which give rise to the spicules of the bone, and then it in series fused into trabeculae, and there is formation of cancellous bone, which is then replaced by mature bone. So in this case, this is the 4 5 steps we have to see. At intramembranous type of ossification or osteogenesis or histogenesis involves like fetal, what is happening here in this process, like cartilage fetal mesenchyme. First is the cartilage, like similar to the cartilage mesenchyme tissue is there, which differentiate into the periosteum, and then it is forming the osteoblast, which will give rise to the spicules of the bone, and then in series it fused into the trabeculae. So there is formation of trabeculae, and then there is formation of cancellous bone, which is then replaced by the mature bone. Now, summary, what is there actually happening? The bones of the cranial cavity and the face ossify by this process, that is the intramembranous ossification. So, what are the bones? So, it's flat bone. What are the flat bone? The bones of the face are ossify, as well as in the cranial cavity bones are ossify with the intramembranous ossification process. At a point center of ossification, osteoblasts are differentiated from the mesenchymal cells, and after that what will happen, if a meshwork of collagen fiber produced by the osteoblast appear between the cells. So what is happening, first is the osteoblast is forming from the mesenchymal cells, and then the mesenchymal cells is producing the osteoblast, and then from the osteoblast what will happen, for there is a formation of what, there is a formation of collagen fiber, and then the collagen fiber it becomes visualized by the capillary network, and the osteoblast produce other organic intercellular substance like mucoprotein, glycoprotein, polysaccharides, etc., and then the organic non-calcified matrix is known as osteoid is formed, and few osteoblasts are trapped into surrounding matrix and are transformed into osteocytes, and simultaneously other osteoblasts proliferate by division and are arranged in radiating manner from the center, which leads to the formation of trabeculae, and these trabeculae join each other to form the cancellous bone. Okay, so cancellous bone will form now, and this the periosteum is developed from the condensation of the mesenchyme. So what is cancellous bone? Now we can see in with the help of our structure, that is cancellous or spongy bone or trabecular bone is the same thing. So this in this way the cancellous or spongy bone is or trabecular bone is forming. Okay, so that is why this is we have seen that is the cancellous bone. Now in another photograph we can see the intramembranous ossification. This is the fetal mesenchyme, which will differentiate later into the osteoblast, which will forming the, we can see the bone formation is start with the formation of osteoblast like this. Osteoblast is surrounding the structure in the mid like this, it is for start formation of the bone, and after that we can see the developing periosteum is the outermost layer, then osteocytes in the mid and osteoblast in the outer layer like this, it is starting the formation. So that is form the cancellous bone and of the cranial cavity and the face bone, and that after that the compact bone of the these bones are forming with the help of intramembranous ossification. Now the endochondral type of ossification or histogenesis, the endochondral ossification, most of the bone of the body except the flat bone are developed by this method. Okay, so most of the bones of the body except the flat bones are developed by this method. So what is happening here, you can see development of cartilage model, first distal epiphysis, this is diaphysis, and this is the proximal epiphysis, which will differentiate, this is the cartilage model like structure where the perichondrium is forming, hyaline cartilage is there, and after that differentiation will takes place and growth of the cartilage model will takes place, which leads to the formation of calcified matrix and uncalcified matrix, and then periosteum is forming. So periosteum is forming in this way, and which will differentiate into the perichondrium and uncalcified matrix at the end of the bone. The calcified matrix is forming like this, this is the periosteum, is the primary ossification center, which will leads to the periosteal bud and medullary cavity, and then nutrient artery are there, After that, we can see the development of the primary ossification center in this way the endochondral type of the ossification takes place. Most of the bone of the body except the flat bones are developed by this method. We know that the perichondrium is there, secondary ossification center is forming at the end of the bone, which is also having the epiphyseal artery and uncalcified matrix. Nutrient artery is there, that is having the nutrient foramen through which the artery is passing inside. And the development of the secondary ossification center in the epiphysis takes place, which will leads to the development of the bone. This is the articular cartilage. This is a spongy bone formation from the secondary ossification center, and we can see the epiphyseal plate is there on the end of the bone, and the formation of articulate cartilage and epiphyseal plate takes place. Now we will see it in detail that most of the bone of the body except the flat bone, means the bones of the cranial cavity and the face, are developing by this method, that is the endochondral ossification. At a first, a cartilage model is formed, in this case by the condensation of the mesenchymal tissue, and the perichondrium appear around the cartilage, and the chondroblast proliferate at midsection of the model by mitosis and arrange in row towards the end. So what is happening? The perichondrium appear around the cartilage, and then chondroblast, not osteoblast, chondroblast proliferate at midsection of the model by mitosis and arrange in row towards the end, and then they mature and hypertrophied, and due to the calcification, death of the cartilage cell leads to the primary ossification center. So in this way, the primary ossification center is formed, and then osteoblast appear in the inner layer of the perichondrium and form subperiosteal or collar bone around the primary ossification center, and the perichondrium is then called periosteum. Now, due to the increased activity of the subperiosteal osteoclast on collar bone, which is eroded, and osteoclast form the secondary areolae, which forms the marrow cavity and filled by the marrow, that is bone marrow. And storage of the or stage of the third or true bone formation is the third stage. In this stage, blood vessel forms along the periosteum and convert the grooves into tunnel, and then lining osteoblast of the tunnel convert the tunnel into the Haversian system, and then the repeating process leads to the ossification longitudinally, and simultaneously new bones are formed under periosteum by appositional growth. Then secondary ossification center is formed at the end of the cartilage model at birth, and this zone is called epiphysis. Ossification occurs in the similar way to the both direction. Now, next point about the endochondral ossification, that at the end a layer of cartilage does not ossify, and it remains as a articular cartilage throughout the life, and in the growth phase a portion of the cartilage model remains as epiphyseal cartilage between the epiphysis and diaphysis, that is called that is the epiphyseal plate, and the epiphyseal cartilage help in longitudinal interstitial growth of the bone and is replaced totally by the bone when growth is complete, and therefore the length of the bone increase with the growth of the epiphyseal cartilage, and the growing part of the epiphysis adjacent to the epiphyseal cartilage is called metaphysis. As we can see in the photograph, this is the development of the endochondral ossification. We can see like this, there is a formation of the primary ossification center first with the help of cartilage model, and then the physis means growth occurs. This is the diaphysis, this is the epiphyseal plate on both sides, this is the epiphysis, and this is the metaphysis just below the diaphysis. So physis is the also known as growth plate. Epiphysis is there, this is the physis, this is the metaphysis. This is the growth plate. In histologically we can see that is having the cartilaginous structure and the cells we can see. So the physis means the zone of proliferation also there, zone of hypertrophy is there, zone of reabsorption, zone of bone ossification, and resting and reserve bone is there. After that cartilage scaffolding we can find new bones, and the zone of ossification is also there, we can see. So the bone grow in by apposition method only. So this bone is growing with intramembranous ossification, or it is either intrachondral. It is apposition method which is leads to the development of the bone. Then the periosteum. Periosteum is a fibrous membranous investing the bone except at the articular surface. It consists of two layers, the outer of which is composed of cores of fibrous connective tissue containing few cells but numerous blood vessels and nerves, and then the inner layer is more cellular and less vascular and contains many elastic fibers. And in the growing bones, the inner layer of the periosteum is osteogenic, and in adult, this layer is converted into row of flattened cells, and periosteum serve as a supporting bed for blood vessels and nerves going to the bone and for encouraging the tendon and ligament. After that, some of the periosteal fibers pass into the bone either obliquely or at right angle to the long axis of the bone are termed as proliferating fibers or sharpies. Then endosteum lines the surface of the cavity within the bone, that is Haversian canal, and also the surface of trabeculae in the marrow cavity. And the cells of the endosteal layer are like those of the periosteum and rest on the thin layer of connective tissue. So now the macroscopic structure, what we have seen, the what is the summary? The bone tissue consists of the bone cells present in the bone matrix. The bone matrix or the intercellular substance is made up of the collagen fiber and ground substance, that is called having the complex mucopolysaccharides. The inorganic or crystalline part of the bone comprises of the hydroxyapatite crystals, and the bone cells are called osteocytes and are found occupying small spaces of in the matrix called lacunae. Okay, and the lacunae are the connected to the one another by the system of canals called canaliculi, and some of the canaliculi open into certain canals that contains capillaries, and this system of connected bone cells is the mean by which the nutrients are distributed throughout the bone tissue, and the mature bone is formed in a thin layer called lamellae, and uh, the lamellae are arranged in the concentric circles called Haversian system. And the Haversian system consists of the concentric lamellae around the central canal called Haversian canal, which we have seen, which contain a capillary blood vessels. So canal is having what? Contain capillary blood vessels. And this lamellae system or Haversian system is also called osteon. Then Haversian system consists of central canal surrounded by the concentric circle of the bony lamellae, and the lamellae in turn are made up of osteocyte found within the empty space called lacunae. So lamellae in turn are made up of osteocytes, which is found within the empty space called lacunae. And a number of canaliculi are found radiating from the lacunae, and the three distinct type of bony lamellae are found: concentric lamellae, okay, circumferential lamellae, and interstitial lamellae. The circumferential lamellae, they are bony lamellae that surrounds the entire bone and forming its outer perimeter. Then concentric lamellae, they are forming the bulk of the bone and form the basic metabolic unit of the bone called osteon. The osteon is a cylinder of bone found oriented along the long axis of the bone. After that, interstitial lamellae, they are lamellae that are found between the adjacent concentric lamellae. They are thus fillers that fill the space between the concentric lamellae. Now, the number of canals are found in bone containing blood vessels that pass into bone from the outside and form the bony marrow cavity. These canals are called Boltzmann canal. The branches of the blood vessels from these canal may enter the smaller Haversian canal, and the bone marrow is found occupying the center of the bone. It is of two types: red bone marrow and yellow bone marrow. We have already seen. Then after that, one term is coming that in mind, that what is bone remodeling. So bone remodeling is ongoing replacement of old bone tissue by the new bone tissue. It involves the reabsorption, removal of mineral and collagen fiber from the bone by osteoclast, and bone deposition, that is addition of mineral and collagen fiber to the bone by osteoblast. So we can see the blood supply we have, that is arterial supply, which is the bone is getting it's supplied by the periosteal, metaphyseal, and epiphyseal arteries, which we can see in this photograph. That epiphyseal artery, epiphyseal vein is there, or is articular cartilage, epiphysis, then below that the metaphysis, and then below that then the soft region, the diaphysis is there. Then metaphyseal vein in the metaphyseal region, then metaphyseal artery is also there, then periosteum, periosteal artery, periosteal vein. Similarly, we can see the medullary cavity in the mid region. The compact bone is on the region is having nutrient foramen, through that the nutrient vein and nutrient artery is passing. Okay, so venous drainage by the periosteal, epiphyseal, and metaphyseal veins are also there. After that, next our tissue is the blood, which is hemopoietic tissue and lymph. So blood, which is including the different cells like neutrophils in the which is having WBC and RBC. WBC including granulocyte and agranulocyte. Granulocyte means neutrophil, eosinophil, basophil, and agranulocyte means lymphocyte. And anybody, if you have idea, you can tell that another type of cells, that is the name of that cells we will see in the coming. You just think about that, because already we have seen blood, or already you have seen it in your previous classes. So blood is the connective tissue containing the free cells and the fluid in the intercellular space or the plasma. The structural element of the mammalian blood include the red blood cells, that is RBC, and white blood cells, that is called WBC or leukocytes, and blood platelets. Then function of the transport of the respiratory gases, nutrient and waste, and the location is within the blood vessels. It is found. Characteristic is the any atypical connective tissue, and it is consisting of the cells surrounding the matrix. By the next point is we should remember that it is having this blood with cells and the intercellular space which is having the plasma. Now the next point which is important to note down here, that what is the RBC. Okay, so they are the highly differentiated specialized for the function of the transporting oxygen. We know that they, in lower vertebrate the erythrocyte is nucleated, but in mammals it loses its nucleus in Golgi body as well as mitochondria and centriole before entering into the bloodstream. And the erythrocytes are acidophilic biconcave disc run around in all mammals, and except in camel and llama where they are elliptical. So this is very important, that what is the shape of the cell. And then the bird, reptile and fishes have elliptical nucleated RBCs or erythrocytes. The birds are reptiles are nucleated RBC are there. On the surface view, the erythrocyte is circular in outline, and the center depression appear at the lighter area depending on the focus. The average diameter of the erythrocyte is as follow in micron: in elephant 9, in man 7.3, rabbit 6.5, cow 6.1, cat 6, horse 5.7, and a sheep 5, and goat 3.7. The number in million per cubic in case of goat 17.3, sheep 11.5, cat 7.2, horse 7, dog 6.1, ox 6, 5. In case of man, guinea pig is also having 5, rabbit 4.6, and chicken 2.9 million per cubic mm is the number of RBC. Now the next point is about the WBC, that is the nucleated. These are the nucleated cell, and they are the true cells because presence of the nucleus, and may be divided into non-granular or agranular or granular or granulocyte varieties. Cytoplasm of the granular leukocyte shows numerous granules. In many, these granules are fine and slightly refractive, but in other they are coarse and highly refractive. These are divided into three classes according to the nature of the staining reaction of the granules present, that is the neutrophil, eosinophil, and basophil. So neutrophil is the first. They are large cells 8 to 12 micron in size. The nucleus shows 3 to 5 lobe connected by the fine strands and in the form of horseshoe. Granules are neutrophilic as they have affinity towards the neutral stain of the Romanowski compound and take the light purple stain. Then eosinophil, these are the larger than the neutrophil, and the size is about 10 to 14 micron. It contains spherical and highly refractive granules which stain with eosin and other acidic dye, and the nucleus generally has only two lobes. Now the next is the basophil. They are rare in adult bloods, and only 5% of the leukocyte it is found, and except in the chicken where they are 3%. The size is 8 to 10 micron, and the nucleus is large, irregularly polymorphous, and the coarse granules are basophilic in this case. Now the next, non-granular leukocyte or agranulocyte. These are including the lymphocytes, which are small about the size of the erythrocytes and are group of largest cells, and the monocytes which have the more cytoplasm and more intended nucleus. First is the lymphocytes. The size of the small lymphocyte varies from 6 to 8 micron, majority being 7 to 8 micron. The nucleus is large, stained intensely, and the basophilic cytoplasm forms a narrow rim around the nucleus. Next is the monocytes. These are the large cell size varying from 12 to 15 micron, but they may occasionally be up to 20 micron, and the nucleus is ovoid, kidney or horseshoe shaped and is centrically placed. Then blood platelets, they are colorless, about 3 micron biconvex disc, but appear spindle shaped when seen sideways. Next, they have no nucleus. They show a central granular mass which stain deeply with basic stains called the chromatomeres, and its peripheral side hyaline lightly stained zone called the halomere, which is found in the platelets. Then lymph. So lymph is a consists of the fluid in which the various corpuscular elements are suspended. Red blood corpuscles and platelets are absent in the lymph. The chief cellular elements are the lymphocyte and few granulocytes are there. Okay, so this is about the lymph. Then covering and lining membranes. This is all about the blood and lymph. And then you know that the combining epithelial tissue and connective tissue, which is forming the covering the membranes, and the covers the broad area within the body and consists of epithelial sheet plus underlying connective tissue. Then what are the type of the membrane? You know that the cutaneous membrane is the skin we can find. Then mucous membrane, which we can see in the lining the halo organs that open to the surface of the body. And epithelial sheet underlaying the layer is called lamina propria. Then serous membrane is the slippery membrane. The simple squamous epithelium lining the on the areolar connective tissue in this case, which lines the closed cavities. That is a pleural, peritoneal, and pericardial cavity. Pleural is around the lungs. Peritoneum is digestive organs in the abdominal cavity, and pericardial around the heart. Now, the synovial membrane lining the joint cavities, we know that these are the loose connective tissue, which is having the areolar tissue plus impulse squamous epithelium. You can find it secrete fluid, that is the synovial fluid, which lubricates, protect, and cushions the joint surface. Okay, so then the blood and nerve supply to the connective tissue. So the connective tissue received its blood supply from the vessels which pass through them, and for which they form the supporting bed. Then, for dense connective tissue, the supply is scanty, and the nerves are numerous in the connective tissue. Some of them terminate in the tissue itself, but other go to the epithelium and muscles and tendon, fibrous connective tissue, and periarticular connective tissue. Having this, we can say that. That is the blood supply and nerve supply. Then reticuloendothelial system. What is this? The cells of the reticuloendothelial system are the macrophage, which engulf the particulate matter like carbon particles, and in the connective tissue they are correspond to the histiocytes. A Kupffer and the Kupffer cells of the liver, reticular cell of the lymph nodes, and spleen and bone marrow, cell lining the sinusoids of the spleen, microglia cells of the nervous system are the example of the reticuloendothelial system. Then we can see that these things we already discussed. So WBC, RBC, we should remember that what are the cells, what are the neutrophils, we already discussed. Just for revision, we can see it. And then non-granular or no granulocytes, we can see the lymphocyte, monocytes. Okay, then platelets is another kind of cells which is very important role playing cells. Then lymph we have discussed. After that, we discussed about the lining membranes, and after that we have seen that what are the different types of membrane, that is cutaneous, mucous, serous, and this is the serous. After that, the synovial membrane. Then blood vessels we have seen. Then reticuloendothelial system. Okay, so this is all about the today's class. Thank you.